Let's talk about COVID-19. Senator, sa kasalukuyan po, dalawang bagay ang alam natin tungkol sa COVID-19, tungkol sa pandemya. Ang una, pinadapa na tayo ng pandemyang ito. According to DOH, over 3 million cases sa bansa, over 50,000 deaths. As of today, sabi naman ng Johns Hopkins COVID-19 dashboard, more than 300 million cases around the world and over 5 million deaths. Maraming mga Pilipino ang nawalan ng trabaho, kabuhayan, at mga mahal sa buhay. Pangalawa po, Senador, aside from being vicious, this virus is unpredictable. Maraming mga variants na ang ating narinig. Alpha, Beta, Gamma, Delta, may Delta Plus, may Omicron. The virus acquires genetic changes. It mutates, in other words. Ano ang form niya sa susunod, kailan, nobody knows. Ang aking katanungan po, kung ikay papalarin manalo bilang presidente ng Pilipinas, and given the unpredictability and the viciousness of this virus, ano po ang iyong programa pagdating sa COVID-19?
Well, when it comes to COVID-19, ang lagi kong sinasabi dyan, I summarize it very simply. I call it jab to jobs. What we first have to do is to get vaccinated. And we have to roll out the vaccines properly. We have to make sure that the vaccines are effective and safe, have been handled properly. And now we have gotten to the point, the last statistic that I saw was 54 million Filipinos have been nabakunahan na, fully vaccinated na. Hindi pa tayo umaabot dun sa tinatawag na herd immunity. Kailangan talaga natin paabutin ng 70-75%. At sana yung kalagayan na nakikita natin sa Europa, sa ibang bansa, kahit tinatamaan ng Omicron, nag-positive, hindi na rin masyadong pinapansin kasi parang flu na lang para sa kanila dahil 95% sila vaccinated. So, dapat yan ang habol natin. Once we get ourselves in a safer condition, that we manage the pandemic, or we have to now be thinking, even while we're just slowly working our way through the pandemic, ngayon pa lang, dapat iniisip na natin kung paano natin ibabalik ng ekonomiya. Kagaya ng sabi ko, ang daming walang trabaho, ang daming nasira ang plano, lahat ng lagay ko, I would even amend that. I would say, hindi marami, lahat ng kahit sino, lahat ng tao sa buong mundo yata naramdaman itong COVID na ito. And so we have to come back to give our people, get them back to work. And how do we do that? We do that, in my view, we do that by revitalizing the MSMEs, the small businesses that comprise 95% of our businesses and 62% of our employment in businesses. And they have been very hard hit. The government can help them with the lower taxes or tax holidays, amnesties, etc. The private sector can come in with microfinancing and all that. Agriculture also needs to be looked at because it's a creator of jobs. And
is this what you mean by the jobs to jobs concept?
Yes, the idea is just once we are in a safe condition, then we have to get people back to work. Yan lang naman ang habol. Pag tinanong mo ang Pilipino, ang palagay mo sa COVID, yung COVID, wala akong trabaho, wala akong pera. So yun ang talagang dapat na priority. Ngayon pa lang pinaghahandaan natin. So agriculture, tourism, and we should do this, we should go back to the concept of PPPs, public-private partnerships. And that way, we can bring together different segments of government working together so that the economy will come back and hopefully come back even stronger than it was pre-COVID.
Of course, we're hoping na sana'y wala ng bagong variants na dumating. Sabi ko kanina, this is so unpredictable, we don't know what's going to happen next. Pagdating doon sa vaccination, hindi pa tayo nakakaabot doon sa 70-75. What is your message to people who refuse to be vaccinated?
Well, they must understand that we cannot force people to be vaccinated. Karapatan ng tao yan. Hindi mo pwedeng pilitin na mag-vaccinate. Ngunit, sana naman maunawaan nila na kapag sila ay hindi nagpapabakuna, ay yung lahat na nakapaligid sa kanila, pati na yung kanilang mahal sa buhay, kanilang pamilya, mga kaibigan, yung kanilang kabarangay, lahat yan ay linalagay nila at risk yan. Dahil kung sila ay tamaan, ay ikakalat nila yan. Ang ang statistic ngayon, ang mga nasa ospital na tinamaan ng Omicron, na 85% are not vaccinated. Kaya't maliwanag naman ang science na sinasabi, malaking tinutulong ng pag-vaccinate. Kaya't sana hiyakatin natin sila, sabihin natin, paliwanag natin. Ngayon, that will also, yung nangyayari ngayon, it will also limit their own options when in their everyday lives. Hindi makapunta sa restaurant, hindi makasakay sa public transport, all of these things. So, but rather than punish them, I think we should really convince them that this is important. It is important for your work, it is important for your community, for your family.
You spoke about the socio-economic recovery of people. Very briefly lang, yung lockdown.
Oh,
Your comment?
No more lockdowns. Hindi na kaya ng Pilipino mag-lockdown. Hindi na nila kaya. It is too hard. They're going to too much hardship already. They just cannot do it. Maraming nga sinasabi, yung labag sa protocol, sinasabi, hindi na bali magkasakit basta may kita ako.
Ngayong Vice President pa lang ako, Boy, nag-launch na kami ng COVID response initiatives. And ngayon, yung ginawa namin, ang pinakasadya lang talaga is to fill in the gaps. Hindi naman namin tumanlato, pero hindi pwede kasi nanonood lang kami. So we shifted from one initiative to another. Nag-umpisa kami sa pag-provide ng PPE sets, sinundan namin ng shuttle buses for frontliners, sumunod yung mga dormitories, hanggang tinulungan na namin yung mga community marts, etc., etc. So it was a series of so many programs. Pero we learned a lot of lessons from that. Ano yung number one lesson? Yung number one lesson, kailangan talaga yung sense of urgency. Kailangan yung sense of urgency sa pag-respond kasi every minute, every second counts. Yung sa amin dito po, yung aming naramdaman dito sa pag-respond dito, hindi pwedeng gagalaw ka lang pag-perfecto mo na yung plano. Hindi eh. Ang kailangan nandiyan na, gumalaw ka na. Pag ako naging Pangulo, i-expand ko yun. Pero meron na kasi akong benefit ng science. Meron na akong benefit ng lessons from other countries. Alam natin kung sino mga bansa yung nag-perform better than the others. So, dapat matuto na tayo doon. We have been following all the examples of so many countries na naging maayos yung overall COVID response. And madali na para sa atin kasi meron na eh. Meron na tayong mga modelo. Susundan na lang natin. Pero ang sisiguraduhin ko lang, I will be on top of everything. Pag sinabi kong on top of everything, yung day-to-day na COVID response, ako mismo yung tututok. Sisiguraduhin ko na whole of government, all the agencies, all the local government units are working harmoniously. Kasi yun yung tingin kong naging kakulangan ngayon. Lahat naman may ginagawa, pero kulang ng konduktor. Kaya ang desisyon ng isang opisina, iba yung ginagawa ng iba. Parang sobrang mixed yung messaging, sobrang mixed. Nakita natin na pagsasabi ng ganitong desisyon, the following day, babawiin, yun yung nakakadagdag sa yung anxiety ng tao.
Okay. You raised 2 points. I'm sorry, VP Lenny. Una, very, very important points. Number one, marami kang mga leksyon na natutunan, mga modelo mula sa ibang bansa. Can you be more specific kung anong mga leksyon, anong mga modelo ang ating pinag-uusapan?
Nung iba-iba yun dito, Boy. Kasi 2020, ano yung natutunan natin? Yung natutunan natin yung 2020, yung meron talagang mga pillars para sugpuin mo yun. Ano yung pillars? Yung testing, tracing, di ba? Saka yung management ng disease. Doon pa lang, nagkulang na tayo. Ini-insist pa din natin na hindi tayo magte-test ng marami kasi hindi naman kailangan. Yung contact tracing, 2 years after the pandemic, hindi pa din tayo nakaka-take off ng maayos. Yung mga hospitals natin, 2 years into the pandemic, kulang pa din tayo ng health workers. So sa akin, kailangan itong mga basic premises na to. Alam na natin na ito yung pillars na kinakailangan natin gawin.
Do you do testing? Do you do all these things that you're talking about before? Because you don't know what's going to happen. Hindi mo talaga alam kung kailan ang susunod ng variant. Do you do this even when there is no surge?
Depende. Kami talaga ginagawa namin siya kahit nung walang surge. Merong mga communities, kasi kami boy, meron kaming tracking system sa opisina.
Okay.
Na tinatrack namin yung lahat ng mga local government units, saan ba mataas yung cases, saan yung ganito. And gusto namin makatulong sa pag-contain. So kahit walang surge, pag nakikita namin na merong lugar na medyo mataas yung cases, nag-o-offer kami.
I only raised that point dahil hindi ka pwede mabigla dahil alam natin na unpredictable talaga.
Yes.
I mean, we know that behavior of the virus. And then you raised another point. I will be on top, of the program, of the management of this virus. Some of your critics may say, isn't that a bit too much of micromanagement and you might be missing on a lot of things dahil nandun ka masyado sa detalye?
Boy, pag panahon ng crisis, kailangan mo mag-micromanage. Kasi buhay ng tao yung nakataya. Ako, since March of 2020, araw-araw, I am on top of all the COVID response operations of the office. At ano yun hindi ako namili talaga ng trabaho. Nung kulang kami ng mga tao sa Bayanihan e-Consulta, ako mismo nagjo-duty. Ang nagjo-duty ako, yung mga unholy hours, para makatulong naman yung aming mga volunteers. Pag swab cup namin, kahit marami nagpa-positive, nandyan ako. Pag vaccine